Again, my name's Ben. I've been a cop here in Albuquerque for, like Jeff said, it's coming up on 18 years this year in August. That time has really flown by. It's hard to describe how fast it's gone. I see a number of people from my class in this presentation. I'm very grateful for you guys being here, and they can probably also attest to how fast this has all happened. I thought I would name my presentation just 2020 things, because not a lot of us had a great 2020. And 2020 for me was the worst year of my life, right up until it became the best year of my life. And we'll talk about, kind of how that happened. This is me, I'm Ben. This is going to be the story of my cancer journey and how sort of having a law enforcement family really became one of my saviors when I was going through this process. And, it's not something I take for granted. I realize there's a lot of folks that don't get such a great second family. And I really felt that through my entire career, and especially this last year in 2020 when, I honestly had to lean on my law enforcement family a lot, and they did not let me down in any capacity. So that's kind of what we're going to be talking about today. I do have some disclaimers. One, I'm a cop, so there's going to be some amount of profanity. I'm sorry about that. It's just that comes with the business. We're also going to be talking, because of the cancer that I had, we're going to be talking about very private part of my body, right? Mainly my genitals. And that's a disclaimer I never thought I'd have to give to a group of people, but here we are. And then there's one picture that is kind of a surgery. It shows one of the incisions I had for one of the surgeries. If you're not into that, I'll give you a warning before I show it. But other than that, this is just kind of the story and how my law enforcement family kind of ties into the whole thing. So January, February of 2020, normal life, right? I'm happy, I'm healthy. I have this great career. Being here at CIU, it really felt like I found my spot, right? Like, this is where I'm supposed to be. I was getting a lot of fulfillment from my work. And not to say that I didn't enjoy my time in the field. I did. I spent, almost 14 years as a uniformed police officer. But this felt like the natural next step. And I work with a great group of people here. We have a great chain of command all the way up to the chief of police. And 2020 was pretty great for me in January and February. And the start of the trouble started right around this time frame. And it started, I'm an avid cyclist. I love to bicycle places. And because of that, I developed an abscess on my bottom in January. So I went into one of the local, urgent cares. They drained it, whatever. And then it came back in February. And this time I made the decision to go to the Presbyterian Main Hospital ER. And it might have been a decision that saved my life. I went there. I had one of the best ER docs I've ever had, hands down. His name is Dr. David Glass. And he took the time. He really listened to what I was saying. He was very thorough. And in this thoroughness, he did a CT scan so they could better visualize the abscess and deal with it. On that CT scan, the radiologist noted that there was some irregularities with some of the lymph nodes in my abdomen near my kidneys, and suggested that I get a biopsy because it was suspected to be some form of cancer. And so that's kind of how this process started. I had no symptoms. I wasn't feeling bad. And, I think about it all the time. If I hadn't chose to go to that ER, if I hadn't got Dr. Glass as my doc, who knows what would have happened. The next thing that happened was I had my biopsy, and it was a surgical biopsy. It was a very strange experience. The whole thing, actually, I'm laying in the CT scanner as they're doing this. I'm semi-conscious. It's like this twilight sedation stuff. And they guide a needle into the lymph node near my kidney. And that's how they did the biopsy. But then I went on a trip. I was a little worried about it, but I'm 38. Like, there's no way I have cancer. The lymph node's probably just swollen from the abscess, the infection. That's what I just kept thinking. And so March comes around, is when I got my results back. March 17th, I had a meeting with my oncologist. the first time I met him. And this is right when the pandemic started happening. And so when they called me to come in, they said, unfortunately, you can't bring anyone with you when you come down. And at the time I thought, no big deal. The doctor's just going to tell me everything's fine, whatever the case is. A little bit later into that conversation, of course, it turned out that I would have given anything to have somebody there with me. So March 17th, St. Patrick's Day, the doc told me that they had found cancer in the lymph node, and they highly suspected it to be testicular cancer. And so the next thing that needed to happen was I was going to have to go get a ultrasound of my testicles. And so the Monday after that's where I went to get that ultrasound. And that is a wildly uncomfortable experience. Like there's just someone rubbing cold lubricant around your genitals, and like you're trying to make small talk, right? Like, so the weather's been nice, but pretty painless, right? They just do their ultrasound. So that was on Monday. On Wednesday, I had a meeting with my urologist to discuss the results of the ultrasound. So 2 days later, I met with my urologist at Presbyterian, and he said they found a small tumor in my right testicle. And so kind of confirmed the testicular cancer diagnosis. And he said they're going to have to remove that testicle. And that was going to happen on Friday. So Monday, ultrasound. Wednesday, talked to my urologist. Wednesday, I'm in surgery to have my testicle removed. And once that came out, Uniball, this pen company, became one of my favorites, made for guys like me, right? I became, more aerodynamic almost immediately, lighter on my feet. So testicle came out. They removed some other structures around there. And when they remove the testicle, of course, they send the tumor to pathology, and they use that to help stage the cancer. And come up with a treatment plan. And I'll go into both of those things in more detail. It is pretty fair to say that at this point, I was way too optimistic, right? I knew I had cancer. I knew I just had a major-ish operation. But for me, it was just like, just another little speed bump in my life. I'm 38, I'm healthy. It's all going to be fine. The next meeting with my oncologist, that really changed. And as soon as he walked in the room, as a cop, you get pretty good at reading people's body language. I knew something was terribly wrong. And my optimism wasn't quite, what it should be. So the way they stage this cancer is there are several different types of testicular cancer. And so the biopsy tells them what type it is. Unfortunately for me, mine was a very rare type of cancer called choriocarcinoma, which is the most aggressive and deadly of the testicular cancers. It has a tendency to travel through your vascular system, your blood system, instead of your lymph system. So it spreads very, very quickly. The next thing they look at are something called tumor markers, which are hormones or chemicals in the blood that kind of tell you how bad it is. The specific one they're looking for with choriocarcinoma is called HCG. A normal male adult has less than 2 milliliters per whatever. Mine were at 20,000. And then they look at has the cancer spread? And so I took blood test, another CT scan, and they found that in the more detailed CT scan that it had spread to the lymph nodes in my abdomen. There was a Lyme-sized tumor on my kidney, and there were spots in my liver. And so testicular cancer is staged from 1A to 3C, 1A being the least severe. And then you get either a good, moderate, or poor prognosis on top of that. So that day, my oncologist let me know I was staged at 3B with a poor prognosis. And that's when it became very real for me. That's when it became apparent that's something that I might not survive. And as you can imagine, it was a very terrible day to have that optimism just taken from me. It was at this point I knew I was in a fight for my life. I knew it wasn't just going to be a speed bump anymore. And, so many things run through your mind. Am I going to lose my job? Am I going to lose my life? And all this stuff. And to make it worse, it was right during the pandemic. So I can't see any of my friends. I can't have visitors. Even when I go in for my hospital visits, I'm always by myself. It makes things really, really tough. So we came up with a treatment plan. I didn't know this prior to, but testicular cancer is actually really, really rare. And not a lot of doctors have experience treating it, even in big places like Albuquerque. And so it's pretty rare. But what they came up with was 4 rounds of something called BEP chemotherapy at 75% potency. BEP are the 3 chemo drugs that they used. One is bleomycin, one is etoposide, and then the P is a platinum-based chemotherapy, which is really kind of the drug that does the most work. So I was scheduled for 4 rounds of that. So 1 round is 3 weeks of chemo. The first week, you have chemotherapy every day for 7 to 8 hours a day, just sitting there getting infused with chemo. For the next 2 weeks, it's just chemo on Mondays only. They kind of let your body recover. And I was going to be doing that for 4 rounds of BEP chemo. That was what my oncologist came up with. That's what the treatment plan was. So the first thing that needed to happen was I was going to have a heart catheter installed. That's it, this picture here. So it's like a self-sealing surface that is under your skin where they can use to inject medications. And then that long, thin tube, they loop through your jugular vein and into your heart. So this little flat part sits just under your skin, under my right collarbone. And then that's how they deliver chemo medications and draw blood. And so it really saves you having to get an IV every time. And because the chemo is so caustic to your body, it really saves your veins and all that type of stuff. So that was the first surgery, or actually the second surgery I had to go through, was to get this installed. That was installed on a Wednesday, and chemo was going to start that Monday. So April was probably the worst month out of this whole thing. They started the chemo. They give you give blood every day so they can check, how it's working, check your levels, check to see if you need other medications and stuff. And for pretty much the entire first round, the chemo wasn't working. There was very little change in my tumor markers. I had to have a pretty frank discussion with a care coordinator at Presbyterian, where she said, start thinking about stuff like getting your will written, and start thinking about what hospice might look like. And I had to go tell my parents that. And it was just a really difficult month for me. And on top of that, I had some stuff going on with my personal life. And this is when I thought the most about giving up. I was already getting sick from the chemo, and everything else was just seeming not to work. I started to believe I was going to die. And so I started pushing people away. I started trying to distance myself from even my parents, thinking that I was doing them a favor, right? That it won't hurt as much if I pass on. Of course, that's just crazy, right? They're going to be destroyed no matter what. But this was also the time where I started getting a lot of text messages, phone calls, well wishes from my law enforcement family, especially the folks in my unit. It's one of the reasons I didn't give up. It's one of the reasons I still got up in the morning and went to chemo, even though I didn't feel like it. People in my law enforcement family, they would text me, they would call me. My unit had these bracelets made up, right? And it says, "No one fights alone." And they would send me pictures of them wearing it, right? And it's such a small gesture, but it meant a lot to me. And again, it's one of the reasons why for a while I thought, I'm done. I don't want to do any more chemo. I just want to die on my own terms. I thought about hoarding my medication so I could end my own life the way I choose. And it kind of switched from that. Towards the end of April is when I got mad, right? I literally got mad. And I said, you know, if it went from the darkest period of my life to, okay, if I'm gonna die, you know, my hands are gonna be on the Reaper's neck when I do. And so sort of my family support, both my actual blood family and my law enforcement family, helped me get to a point to turn that, to have that frame of mind switch into, I'm going to fight, and you know, maybe there's a chance that we can beat this. As I mentioned before, not a lot of doctors have a lot of experience treating this. So I did some research, and I found a man named Dr. Lawrence Einhorn, who works at the University of Indiana. In 1970, he is actually the guy that discovered platinum-based chemotherapy, and took testicular cancer that had spread from 100% mortality rate to a survivable illness. He's the guy that found that and did that. He's in his 80s, and he still works at the University of Indiana. I emailed him personally, not expecting a response. He responded to me in less than an hour. He responded to me personally. This man is in his 80s, and I think he responds to every email sent to him by doctors, or more likely desperate young men such as myself. And so I emailed him, I gave him all the details, the scans, the blood work I had, and I said, can you please provide some direction? And he emailed me back, and he said yes. And then he called my doctors. He called my oncologist, and he gave them, you know, suggestions on how they needed to change my therapy, and probably no doubt saved my life. And this is just one of the, you know, amazing people I met along this journey. 80 some years old, could have retired, you know, 3 decades ago or whatever, still answering every email he sends, still consulting, has saved probably tens of thousands of young men. And for those of you not familiar, testicular cancer really is a young man's disease. Most often it's like 18 to 30 that people get it. I got it very, very late in life, 38. So late that I'm part of a Facebook group for testicular cancer folks, a support group, and they all call me grandpa on that group. It's not my favorite term, but I mean, there's a lot of 18 and 20-year-old kids that are on there. And this guy is just saving them by the dozens, right? Just taking time out of his day to do that. So he gave my doctors an updated treatment plan. And basically, it was, they're going to have to go all out if I have a chance. They're going to have to go to the maximum amount of chemo allowable under US guidelines for the remaining rounds of chemo I had. I was also going to do something called high-dose chemotherapy with stem cell rescue. One of the limiting factors of chemo is that it kills a lot of your immune system. It just completely wipes it out. And then you're susceptible to getting very sick. And this was during COVID. And so this additional round of high-dose chemotherapy, it's the reason they can give it at such high doses is because in the days prior to that, they harvest your own stem cells out of your body. They give you the high-dose chemo, and then they reinfuse you with your own stem cells. So at least you have some amount of immune system in between that. And then he told us that there's going to be possibly a major surgery that needs to be done, assuming that chemo is successful. May. Great news, the maximum dose chemo starts working. We start seeing my numbers fall. The bad news is that I am as sick as I've ever been in my life. Looking back at my paperwork, the day of diagnosis, I weighed 174 pounds. By the end of chemo, I weighed right around 135. You know, I didn't actually vomit a lot during chemo, but it killed my appetite. There was just no appetite. I had these huge sores on my tongue and mouth that made it very difficult to drink and eat. And, you know, I just kept getting thinner and thinner and sicker and sicker. And so kind of a double-edged sword, you know, the chemo started working, which I'm obviously incredibly grateful for. But I was so sick. And, you know, prior to going through this experience, I would see, you know, folks with cancer and assume that the cancer was what was making him so pale and skinny and sick looking, and it's probably actually the chemo that's doing that. And my oncologist once told me, he said that we are going to look back on chemotherapy in the future like we look back on lobotomies now, right? Like, it was a great practice. It saved a lot of lives, but it's probably going to be viewed as pretty barbaric, because it really, the way chemo works is it kills fast growing cells, rapidly reproducing cells. And so it kills cancer, but it also kills like your stomach lining, the inside of your mouth. Obviously all your hair falls out because that's a fast growing cell. It's killing a lot of you as well as the cancer. And, that's pretty much what hallmarked May for me, was just how terrible I was feeling. And again, throughout this process, I'm getting so much support from a lot of the folks at APD, including a lot of the folks that are logged on today, that I just couldn't be more grateful for. And I can't imagine having to go through this without my law enforcement family. I really can't. Like, I don't know if I would have survived this. I don't know if I would have survived that April if it hadn't been for my law enforcement family. So June or July, chemo finally ends. The big question is, did it work? If this picture looks strange to you, it's because I don't have any eyelashes and barely any eyebrows. The good thing about losing all the hair on your body is you don't have to shave. The bad thing is you have to tell people you're surprised because they can't see it with their eyebrows. But yeah, you lose all the hair on your body. Chemo ends, and then you do another set of blood tests and you do another set of CT scans. And that's how they tell you if it's going to work or not, if it worked or not. And it takes like a week to get those results. And it's the most anxiety-ridden week of your life, right? I mean, your life hangs in the balance here, and you're just waiting for those blood tests to come back. And with something like choriocarcinoma, the cancer I had, it's so aggressive that even if a little trace remains, it's just going to grow like wildfire. And since I did the maximum allowable chemotherapy, if it didn't work, there's not a lot of options left for me. So we got the blood work back, and it came back perfect. My tumor markers were less than 2 for the first time in months. But when they looked at the CT scans, there was some concerning stuff. There was still a Lyme-sized tumor attached to my kidney, and there was still some lymph nodes that were swollen bigger than they should be. And unfortunately, there's just no way to know if that's necrotic tissue from the cancer being killed or if that's hiding live cancer in there. So we again consulted Dr. Einhorn on what the next steps should be. He recommended a surgery called RPLND, retroperitoneal lymph node dissection, as the next step. And I'll get into exactly what that surgery entails here in a second. So chemo had ended, and we were awaiting a surgery date that was scheduled for August 19th. And in between that time was good to me. Again, my last day of chemo, you ring a bell. The reason I put this picture in here is I happen to see some of my coworkers at the hospital, but you can tell from this picture how skinny I am, right? There I probably weighed 135 pounds. It was right after chemo. And I was driving from the hospital, and I just saw my coworkers in the parking lot who were working, and stopped and took a picture with them. And then, of course, my last day of chemo was a big day. Not everybody that gets a diagnosis makes it to that last day of chemo and gets to ring that bell. And so those of us that did really appreciate it and celebrate it. And so I think that was on June 26th was I rang the bell for my last day of chemo, big day. This was a drive-by parade that my unit arranged for me. It's COVID times. They couldn't throw me an actual party, but they did a drive-by parade, lights and sirens. They came by my house. They dropped off signs. They dropped off all these stuffed animals for me. My mom was crying. It was just a very emotional period, and another testament to how great my law enforcement family was through all of this. And Here on the bottom left is a bunch of get well letters from Detective Saavedra and his two little girls. You know, and this is the kind of support that I got, and you know, couldn't ask for more, really. And it was coming in, the support was coming in all over. You know, I know Niels would text me and call me. Melissa would check on me. Even Deputy Chief Garcia, you know, he and I would exchange emails. And I had told him, you know, at the beginning, you know, sir, I'm going to be back. Don't worry about it. And he just straight up told me he had no doubt that I would be. And hearing that from a deputy chief, it means a lot, right? It means a lot. So this was the time in between my chemo and this big surgery that we're going to talk about. So all of my care was through Presbyterian. That's where I get my insurance from. That's where I get all my services from. Unfortunately, Presbyterian didn't have a surgeon that can do this big of a surgery. In fact, there's only one surgeon in the state of New Mexico that can do this. He works at UNM. He's the head of urology at UNMH. His name's Dr. Michael Davis. So I go to my pre-surgery meeting. I'm talking to one of his resident doctors. It's kind of a funny, morbid story. But you know, he's like, do you have any questions? And I'm like, well, what are some of the major side effects to this surgery? And the first thing he said was, well, you could die. And I'm like, well, bro, let's start out with something a little smaller here. Yeah, I know I could die. Like, let's assume that I'm not going to, and then tell me what are some of the side effects. So I don't know, maybe that resident needs a little bit better bedside manner. But we talked about the surgery. UNM did their own CT scans, and Dr. Davis met with me and he said, there's probably no way to save your kidney with that giant tumor attached to it. I'm just gonna let you know. And I said, you know, okay. If that's what it takes, then fine. So RPLND surgery is a major surgery. What they do is the incision is from the bottom of your sternum all the way to the top of your pubic bone. Then they open you up, they displace your intestines, they move them out of the way, and they're accessing what's called the retroperitoneal space, which is like the space where your kidneys sit. Once they're back there, they remove any masses and they remove as many lymph nodes as they can see. That is both to diagnose cancer and to prevent reoccurrence. So they go in there, they get the masses, and then they remove as many lymph nodes as they can. And in my case, they didn't think it was possible to save my kidney. So report to UNMH for this big surgery. I'm obviously scared out of my mind. And again, my parents had to just drop me off in the parking lot, and I got to walk away from them and go to this big scary surgery. And I really feel for anybody who has to be in the healthcare system during COVID, because it's a tough thing not to see your loved ones right before you go into surgery or right after, whatever the case may be. So I go in a process. I didn't specifically mention this, but there are 11 minor surgeries during the course of my chemo. So I'd become pretty accustomed to this process. This was obviously the biggest surgery I was going to have, but you know, the process becomes pretty familiar. The only difference was this time they gave me, they asked me if I wanted an epidural, and from the research I was doing, you know, I did. And so, you know, they had you bring your knees up to your chest, and then they stick a needle into your spine and give you an epidural. And that was really the last thing I remember before the surgery started. The surgery took 8 hours. To UNM's credit, one of the OR nurses herself called my mom every half hour to let them know how I was doing and to keep them updated. Just a small thing that they could do because, you know, my parents couldn't be there. And so 8 hours later, I woke up. Dr. Davis said, "This is me, and I didn't give you guys a warning. I'm so sorry, but that's the incision. I don't know if you're trying to set a world record with this incision or what the deal was, but that's what it looks like." So I woke up from surgery. The epidural didn't work, so I was in an incredible amount of pain when I woke up. The nurses got that under control pretty quickly. Dr. Davis said, "Hey, we removed a Lyme-sized tumor. We removed 29 lymph nodes, and I was actually able to save your kidney. And I was like, wow, what a show off, you know, you're so good. But no, very thankful for Dr. Davis and his surgical skill. You know, now the big question was, they're going to send all the stuff they took out of me to pathology. And if there's any cancer remaining, we're in trouble, right? We're in trouble. There's no more chemo available. But if everything comes back with no cancer in it, I'm in remission. And so after surgery, I spent about a week in the hospital. On day 3, August 21st, Dr. Davis strolls in and said, hey, got your results back. No cancer, you're in remission, and then just walks out of the fucking room like nothing happened. And I was just stunned. You know, I had been chasing this dream of remission for months, and it's just like, hey, bro, good news, and then walked out. I was like, just dumbfounded, you know. I couldn't believe it. I obviously started crying. I called my mom. She was crying. You know, I made a Facebook announcement. So many people had been on this journey with me that they deserved that good news as well, right? And so it was such a great moment. Despite his, you know, him just walking out of the room and letting me know, it is such a turnaround, such a miracle from what we all thought was going to happen. We all thought what my chances were with having such advanced cancer. And it is just a big moment for us. So September through today, again, my law enforcement family set up a fundraiser for me that raised almost $10,000. As you guys can probably guess, it's pretty expensive, all that stuff. I got my bill from UNM for that hospital stay and the surgery, and it was $237,000 before insurance. So my insurance is obviously going to cover a lot of that. Chemotherapy is also $20,000 a week. And so they set up a fundraiser, and all these officers, some I had met, some I haven't met, donated to me and left me kind messages on this fundraiser. And it just, again, never really felt more of a family than I did then, and willing to just give money and give support to, you know, a fellow officer that maybe they had never even met. My recovery from the surgery was obviously very long. At first, I couldn't even walk. I couldn't hold the pen in my hand. There's a lot of nerve damage that happens because it's so close to the spine where they're operating on. And so recovery was slow. But, you know, we got there. Nowadays, I'm back on my bike. I'm lifting weights. I'm gaining weight. My hair obviously started growing back. I'm healthy. I just had my 6-month follow-up and we're all clear. And then, you know, this bottom line, I found myself. I truly did. You know, prior to this year, you would hear stories of people that had gone through something traumatic, and you're like, and they're talking about how that's the best thing that ever happened to them. And you're like, you're out of your mind. That's the best thing that ever happened to you? That sounds terrible. But I mean, you know, I look at things so differently nowadays. You know, I take less for granted. I appreciate more. I savor the good moments more. You know, I often will say nowadays, it's impossible for me to have a bad day. You know, it's impossible. Like, I wake up, I'm not sick. It doesn't matter what happens that day. It's going to be a good day for me. And so all those changes happened. And that's when, you know, 2020 went from my worst year ever to my best year ever in a very short amount of time, and kind of how that whole year went. Here's some pictures. After that RPLND surgery, you're put on a no-fat diet for 4 weeks. And so after the 4 weeks, I was so skinny, and I went in and I saw Dr. Davis, and he was like, you need to eat a fucking cheeseburger. And so that's exactly what I did. Doctor prescribed a cheeseburger. That's a picture of the first one I ate. I started to travel again. You know, this bottom picture, get yourself somebody who looks at you like I'm looking at this donkey. You know, the events of this year really kind of awakened a wanderlust in me, this desire to travel and experience life, and and do all that kind of stuff. So that's kind of what I've been doing since then. I am on a strict surveillance protocol, meaning every 2 months I have to take blood tests, and every 6 months I have to get CT scanned just to make sure that there's no chance of reoccurrence. I emailed Dr. Einhorn one last time to let him know thank you, and let him know the good news that I was a survivor. And he said, based on everything, that I have a less than 5% chance of reoccurrence. So that's really good news. And so far, all my blood work has been perfect. I've been steadily getting healthy ever since then. I'm back at work. You know, I'm just going 100 miles an hour now. I don't want to take anything for granted. I'm so grateful for all the folks that supported me during all this time, most of which are law enforcement folks, and a lot of them are logged on here today. This was December 26th, exactly 6 months after I rang the bell out of chemo. Picture I took with the bell that they gave me from ringing out. So 6 months from the end of chemo. That's the picture. I'm happy to answer any questions, and I do mean anything. If you guys have questions about anything, I'm happy to answer that.
If you guys have any questions, you guys can either unmute yourself and ask, or you can type it into the chat and I can read it for you.
Yeah, Mondays for Melendrez. That was something that my unit did. Every Monday, I would get pictures of them with this bracelet on. Just such support.
I have a question. You had talked about body image, and can you talk a little bit about that?
Yeah. So, you know, after you get the remission and you come out of surgery, and you know, everyone's like, you must be the happiest person on earth. And, you know, you just made it off this mountain. And, you know, you are happy, but at the same time, you're like, I didn't want to be on that fucking mountain anyway, you know? And your kind of my life was completely destroyed, you know? And one of the things that was a huge change for me is after 11 surgeries, I have an enormous amount of scars all over my body, including one that looks like they tried to make a canoe out of my body, you know? And, you know, I always thought that scars were cool and, you know, they were tough, but then you see yourself and you're like, it's not an insignificant disfigurement that's happened to you. And I struggled with that. I struggled with my body image. I was so skinny. I had all these scars on myself, and it was hard to look in the mirror. And, you know, so I went to therapy to help with, you know, some of obviously the traumatic stuff that I went through, thinking you're going to die for a long period of time. But again, to help with my body image, because it's something that I'd never thought about, right? I always thought, oh, cool, scars, you know, but then you see yourself and you're like, good Lord, what happened to my body? It's never going to be the same. You know, I don't get to go back to a time. And I struggled with it, and I struggled with my self-confidence, and, you know, I'm like, well, I'm never going swimming again. That's the end of that. Or I'm going to wear like a giant one piece, something. And then, so I've been working with a counselor, and, you know, have made a lot of good strides in that area. And, you know, something he asked me to do is, I went on vacation and there was like a spa there. And he's like, just take off your shirt and get in the spa. And so I did. And guess what? Nobody gave a shit. Like, nobody was staring at me. Like, the world continued. And so that was good for me to see. Like, you're just assuming that as soon as it comes off, people are gonna be like, oh my God, what's Quasimodo doing over there? But, you know, people don't care. And I think the person that cared the most about that was me. And so it was just an obstacle I had to overcome. But there was some definitely, and you know, I still struggle with it a little bit, having all these new scars, but more and more they're becoming a part of the story of Ben, as opposed to something terrible that happened to me. They're just becoming, you know, kind of an atlas or roadmap of what I've been through. So definitely body image issues that I didn't expect, and I appreciate the talk, Doc, about that.
Sure. Thank you. And that was great. Thank you for sharing.
Hey.
Hi, Casey.
Ari, we're sharing an office. Detective Cassandra Bailey, CIU. Ben, having been through something similar, but in nowhere near the extent that you've been, I just remember experiencing like an identity type crisis where the thought of not being a police officer anymore affected me almost more than the thought of death itself. Did you experience anything like that? And how did you deal with that? You know, because we talk about body image, but about our, you know, identity as a whole.
Right. No, that's a great question. And it's definitely something I experienced both at the police department. And for those who don't know, I also teach part-time at a local university. So I was worried about both jobs. And when I sent Chief Garcia that email saying, I'll be back, you know, what I'm really asking is, please don't let me go. Don't fire me. I still want to be a cop. And so when he responded, like, there's no doubt in my mind you're going to be back, that really put that, you know, it really helped me out, because the thought of not being a police officer anymore it's so scary, right? For us that started young, it's been our whole life, our whole adult life. We grew up being cops. And so, you know, emailing Chief and him saying that, you know, your job is going to be here. We can't wait for you to get back. And then I got a call from my boss at CNM, and he said, you're going to have a job here no matter what. And so both of those things really, really made an impact, because like you're saying, the thought of not being a cop anymore, especially before you're ready for that to happen, was really, really scary for me. But yeah, great question.
Ben, I know you're really good at reading chat, but I'm going to read it anyways for you. So Shanda Harris said, so proud of you. Maureen O'Brien said, wow, Ben, I didn't realize what you went through. Thank you so much for sharing your story. I'm really glad you still have your sense of humor. That is very true. Dave Padilla said, chicks dig scars. I don't know what he means by that. Rochelle Wright says, thank you so much for sharing your story. And then she has a couple questions. Did you have a care support person that would help you during chemo? And that's number one. Number two, did you move back to live with your family, or did you choose to be in your own home?
So yeah, first question, did I have care support? Yeah, I had a person assigned to me, a care coordinator, nurse. No one could be with me during chemo, which was really unfortunate. Nobody could visit me. I had to do it by myself. I have a really kind of tender story involving one of the chemo nurses. It was my fourth round of chemo. I was so sick. You know, I was just so sick. And for whatever reason, I went to chemo that day, and I'm not proud of it, but I just started bawling. I started crying. And this chemo nurse named Margarita, you guys know how busy nurses are, how valuable their time is. She came and sat next to me for 15 minutes, right? She didn't say anything. She didn't touch me. She just sat and was miserable with me for 15 minutes. And it meant so much, right? You know, that she just, that small gesture. So, you know, I did have very good personnel during chemo. Unfortunately, no one personally that I knew could come visit, which is usually the case if it's not a pandemic. So I lived by myself as long as I could, but then I started getting too sick. I moved in with my folks, best people on the planet, because I was too sick to even drive. I could barely feed myself towards the end of the chemo there. And obviously after the big surgery, you know, I couldn't walk. I had to have help, you know, showering, going to the bathroom, all that stuff. So I moved back in with my mom and dad, who, you know, the best people in the world, and went through this journey, obviously, with me step by step.
Awesome. Emmanuel Erez, I probably butchered your last name. I apologize. But he says, thank you so much for sharing this, Ben. Such an inspirational experience. I relate to this so very much, having had loved ones whom faced cancer. And then he follows up with, all warriors have scars.
That's a great perspective. Thank you, sir.
Maria Wolf says, I knew you were having a bad time and honor you for sharing with us. Do you find that sharing also helps you process it all?
100%. 100% I do. I appreciate Scion for that very reason, because, you know, sharing these experiences helps us process it as well. At least that's what I found. And so, yeah, it's a great opportunity. I really love the program. I think it's helpful for the listeners, and I think it's helpful for people like me who get to go and share their story. It's cathartic. It really is. Like, you get something from the experience. You get something from having to talk about it. This is the first time I've talked about it in detail. I've written about it, but never spoken about it. And so, yeah, it's a good feeling to get it all out there and to have, you know, wonderful people like yourselves leave me kind comments. It's just, it's a great program. I hope Scion continues for a long time.
Yeah, we're hoping it keeps going. Rochelle Wright follows up with, thank you again for sharing such a personal story. I have to go to another meeting. Thanks for having Scion. And then Greg Valentino writes, thank you for your presentation.
Absolutely.
Jeff, I had a comment. Melissa Schultz from APD Peer Support. Ben, I wanted to say thank you for sharing your story in detail. You've had a massive impact on my career professionally and on me personally as well. One thing I really appreciated, though, was you acknowledging the decision that you can make with a cancer diagnosis of like, I'm not going to do anything about this, you know? And like, I have always appreciated you as a friend because I feel like I can speak to you like sort of in that, those things that you can't say to anyone else, you know? And that's one thing that I know we had talked about in my own struggles is kind of that idea of like, other people have this foregone conclusion that you're going to be like the poster child, you know, for all this stuff. And I'm so grateful that it ended up that you did fight and pursue all of these things and everything, but just to come out in the open and be truthful about some of those struggles of just like, you know, it's not always, the immediate thought is not always like, you know, fuck yeah, I'm gonna fight cancer.
Yeah.
So I just appreciate that honesty from you.
Thank you. Yeah, it definitely wasn't my first thought. And I see the chat. Thank you, Patricia. Thanks, Andrew. I really appreciate that.
Ben, I have a question. Kind of being like an outsider in this, how did you see it when people reached out to you? Like, did you feel like you got annoyed or overwhelmed maybe because so much came in? Or did you feel overwhelmed because you felt like you had to respond back? And how would you address that? Like if this happened again, or if this happened to someone and they were looking for advice?
What a great question. And so one of the things that happens, I think, is, you know, I want to talk about what's going on. I want to talk to people about cancer and about dying and about facing my mortality. Nobody else does, right? Nobody wants to talk to you about that, or they feel scared to talk to you about that. They don't want to like accidentally offend you. And so you get in this weird position where you're just exchanging pleasantries. But if I was to give you advice on, you know, the outpouring of folks that were texting me was so beneficial. Like, it was such a lonely experience. And anytime I'd get a text or a picture, it was just like one of the ways I could have to talk to somebody about what was going on. But yeah, it's this weird thing where, you know, and to be fair, I don't think people really know what to say. But, you know, just texting me a picture of somebody wearing this bracelet probably saved my life. And so, you know, reach out to folks, be available to listen. If you wanted to know something, you know, like what's life like with one testicle, just ask them that. You know, they want to talk about that kind of stuff. They want to, you know, get it out there. Just a really quick funny story about that is, you know, not too recently ago, maybe a month ago, I had a CT scan follow-up with a nurse I had never met, and she had never met me. And so she was reading my CT results, and she's like, pancreas normal, liver normal, right testicle absent, kidneys normal. And I went, whoa, 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 what the fuck do you mean my testicle's absent? What happened to it? I came here with two. And like, just, she was so horrified, but she ended up being a good sport about it. But that's the kind of stuff we want to talk about. And, you know, people are kind of maybe shy about asking questions or checking in on you, but 100% appreciated every text I got. Didn't feel obligated. You know, I wanted more communication. So, you know, that's the way it went. Reach out, talk to people. They probably want to talk about it. You're not going to offend them. Just ask and be there for them. I see you have a question. Did I ever contemplate suicide? Absolutely did. I had started to hoard my pain medications because this thought in my mind during that April period was, I don't want to just wither away and die and just be sick like that. I want to go out on my own terms. So I started hoarding my pain medication with that thought in mind. You know, it was a dark time, something I did contemplate. But you know, that the end of April, beginning of May, kind of decided that if I was going to die, something was going to have to kill me. Otherwise, I'm going to be here.
Awesome. Ben, I always appreciate your honesty and your openness and your candidness with pretty much everything that you talk about. You know, it makes a huge difference, and it helps take out the stigma of everything that we've talked about. I think like a lot of it, like you were saying, right? We're talking about cancer, and do we talk about death, not talk about death, and it's kind of taboo. But the more I listen to you and your story, the more it's inspirational to me to tackle that taboo and that stigma that comes with it. Does
That's
anyone? Oh,
Thank you.
yeah. Another question just came in. It said, "Did you ever struggle with the choice of receiving care during the pandemic?"
Not sure I understand. Like, did I ever consider just not getting treatment? If that's the question, then absolutely did. There was a part in April, is like, I don't want to do chemo anymore. If I'm going to die anyway, like, this is just making me really sick. And you know, the thing with COVID is when you go through chemo, your immune system is non-existent. So if I would have got COVID, I wouldn't have survived that, most likely. And so I even had to, I was living with my folks at the time, but I had to quarantine from them. Like, they couldn't just come in my room. And if they did, we both had to be masked up. You know, there's never a great time to get cancer, I would say, but this certainly was not a great time to get it. But yeah, there was times when I just thought, I don't want to do this anymore. I don't want treatment, all that kind of stuff.
Tina wrote, "Your parents are role models. Awesome, the unconditional and supportive love from them." And then Mark wrote in, "Thank you, Ben. Stay strong. God bless. You are a warrior."
My parents are definitely role models. I can't imagine how hard it was for them to drop me off at the hospital and watch me walk away not knowing I would survive that surgery, right? That, to me, that's what I look up to, is my mom. And having to see her son go through all that and not being able to do anything, God, it's got to be so tough. I can't imagine that. And you know, my mom did it, and she didn't complain. If she cried, she kept it to herself. She always put on a strong face for me, and you know, total role model for me. If I ended up, you know, as a 60-year-old that was exactly like my mom, I would be proud of that.
Hi, good afternoon, everyone. My name is Emmanuel from Chicago Police Department. Ben, I had a question for you. I actually wanted to know, during the time that you were going through everything that you experienced, was there anything in particular that you found comfort in, whether it was maybe journaling or anything during that time, that even maybe a piece or a sound of advice that someone may have given you that maybe you felt wasn't going to be as helpful, but you actually ended up utilizing it?
Yeah, great question. So one of the things that I found a lot of comfort in was reading other people's story that had been there. So I read every piece of thing I could find on the internet about testicular cancer and people's survival stories. Then I moved on to just any cancer people have survived. I started reading their stories. I read Lance Armstrong's book. It turns out he's kind of a douchebag, but he did go through some shit, and his book was helpful. It was so comforting for me to read about what other people went through and then came out on the other side. And I joined that Facebook group, which has thousands of members from all over the world who have gone through stuff like that. And I was able to ask questions, that only they would know the answer to. And so I found a lot of comfort in that as well. Just reading other people's stories, seeing that people have survived this, people have come through it, being able to ask questions were some of the things. And then I did start a blog. And just writing has always been kind of therapeutic for me. So the act of writing, kind of journaling, was in fact therapeutic for me. Just getting out all my thoughts helped me feel a little less isolated. It's a great question. And the Bears made the playoffs, I heard. So congratulations to you guys.
Ben, I have a question. This is Deborah at CNT. When you were told and having to contemplate for such a long period of time the possibility that you might not survive this diagnosis and some of the other things you went through, did you have a process where you began to really think about death? Do you feel like you ever got to a point where you were really working with it, like I might die, so how do I feel about that? Such a absolutely terrifying existential crisis.
Yeah, that's a great question. And this sort of like low level, not in your face threat is very difficult for officers to deal with, especially.
Yeah.
Because we want to see a bad guy, we want to get in a fight with him, but this is something we can't fight, we can't face, we just have to wait. And I was so terrible at dealing with that low level kind of prolonged anxiety and fear. But there was a point where I started to get comfortable with the idea. I did have my will made up on the suggestion. I was considering, I talked to my parents about hospice and what it would look like, and so you hope that you never have to think about that before you're 80 or 90 years old or whatever. But that's a great question, because you have to start becoming a little comfortable with the fact that you might not be around, and you start thinking about things like, did I do enough while I was here? Are people going to remember me? How are my parents going to feel? And that kind of stuff. So, I would say as a person, I wasn't great at dealing with that kind of low level, prolonged stuff. I don't know if anyone really is, but especially for us type A personalities, it's very difficult to not have a tangible threat that we can fight back against.
Thank you.
Question, do you have kids? Can I have kids? So I don't have kids, and I can no longer have them, naturally. Because of both the chemo and the surgery I had, it's no longer possible. But yeah, I don't have any kids and can't have them. Jeff. Thank you so much, Ben. Your story is inspirational. You were making a difference by sharing that. That's a great compliment. Thank you so much.
Awesome. Does anyone else have any other questions or comments for Ben? Sweet. If you guys have any questions or comments for Ben, you can always email myself, Dr. Rosenbaum, or Melissa, and we can get them to Ben, and he can follow up with those questions as well. Melissa will be sending out an email that has a survey in it. If you guys can take the survey, express your guys' thoughts and opinions on Scion. We're trying to continue to have it grow and continue to get better in all that we do. Ben, again, thank you so much. We appreciate your story, appreciate your resiliency and your example. And we hope to see you guys all next next month in February. And I can't remember exactly what date it is. It'll be February 4th. So we will see you guys all February 4th.
Thank you. Thanks, Ben.